Question 101. Which of the following symptoms is associated with ulcerative colitis? A. Dumping syndrome. B. Rectal bleeding. C. Soft stools. D. Fistulas. Question 101. Answer: B. Rectal bleeding. Question 101. Explanation: in ulcerative colitis, rectal bleeding is the predominant symptom. Soft stools are more commonly associated with Crohn's disease, in which malabsorption is more of a problem. Dumping syndrome occurs after gastric surgeries. Fistulas are associated with Crohn's disease. Question 102. If a client had irritable bowel syndrome, which of the following diagnostic tests would determine if the diagnosis is Crohn's disease or ulcerative colitis? A. Abdominal computed tomography, CORT, scan. B. Abdominal X-ray. C. barium swallow. D. colonoscopy with biopsy. Question 102. Answer: D. Colonoscopy with biopsy. Question 102. Explanation: a colonoscopy with biopsy can be performed to determine the state of the colon's mucosal layers, presence of ulcerations, and level of cytologic development. An abdominal X-ray or CORT scan wouldn't provide the cytologic information necessary to diagnose which disease it is. A barium swallow doesn't involve the intestine. Question 103. Which of the following interventions should be included in the medical management of Crohn's disease? A. Increasing oral intake of fiber. B. Administering laxatives. C. Using long-term steroid therapy. D. Increasing physical activity. Question 103. Answer: C. Using long-term steroid therapy. Question 103. Explanation: management of Crohn's disease may include long-term steroid therapy to reduce the inflammation associated with the deeper layers of the bowel wall. Other management focuses on bowel rest, not increasing oral intake, and reducing diarrhea with medications, not giving laxatives. The pain associated with Crohn's disease may require bed rest, not an increase in physical activity. Question 104. In a client with Crohn's disease, which of the following symptoms should not be a direct result of antibiotic therapy? A. Decrease in bleeding. B. Decrease in temperature. C. Decrease in body weight. D. Decrease in the number of stools. Question 104. Answer: C. Decrease in body weight. Question 104. Explanation: a decrease in body weight may occur during therapy due to inadequate dietary intake, but isn't related to antibiotic therapy. Effective antibiotic therapy will be noted by a decrease in temperature, number of stools, and bleeding. Question 105. Surgical management of ulcerative colitis may be performed to treat which of the following complications? A. Gastritis. B. Bowel herniation. C. Bowel outpouching. D. Bowel perforation. Question 105. Answer: D. Bowel perforation. Question 105. Explanation: perforation, obstruction, hemorrhage, and toxic megacolon are common complications of ulcerative colitis that may require surgery. Herniation and gastritis aren't associated with irritable bowel diseases, and outpouching of the bowel is diverticulosis. Question 106. Which of the following medications is most effective for treating the pain associated with irritable bowel disease? A. Acetaminophen. B. Opiates. C. Steroids. D. Stool softeners. Question 106. Answer: C. Steroids. Question 106. Explanation: the pain with irritable bowel disease is caused by inflammation, which steroids can reduce. Stool softeners aren't necessary. Acetaminophen has little effect on the pain, and opiate narcotics won't treat its underlying cause. Question 107. During the first few days of recovery from ostomy surgery for ulcerative colitis, which of the following aspects should be the first priority of client care? A. Body image. B. Ostomy care. C. Sexual concerns. D. Skin care. Question 107. Answer: B. Ostomy care. Question 107. Explanation: although all of these are concerns the nurse should address, being able to safely manage the ostomy is crucial for the client before discharge. Question 108. Colon cancer is most closely associated with which of the following conditions? A. Appendicitis. B. Hemorrhoids. C. Hiatal hernia. D. Ulcerative colitis. Question 108 Answer: D. Ulcerative colitis. Question 108 Explanation: Chronic ulcerative colitis, granulomas, and familial polyposis seem to increase a person's chance of developing colon cancer. The other conditions listed have no known effect on colon cancer risk. Question 109. Which of the following diets is most commonly associated with colon cancer? A. Low fiber, high fat. B. Low fat, high fiber. C. Low protein, high carbohydrate. D. Low carbohydrate, high protein. Question 109 Answer: A low fiber, high fat. Question 109 Explanation: A low fiber, high fat diet reduced motility and increases the chance of constipation. The metabolic end products of this type of diet are carcinogenic. A low fat, high fiber diet is recommended to prevent colon cancer. Question 110. Which of the following diagnostic tests should be performed annually over age 50 to screen for colon cancer? A. Abdominal cord scan. B. Abdominal X-ray. C. Colonoscopy. D. Fecal occult blood test. Question 110 Answer: D. Fecal occult blood test. Question 110 Explanation: Surface blood vessels of polyps and cancers are fragile and often bleed with the passage of stools. Abdominal X-ray and cord scan can help establish tumor size and metastasis. A colonoscopy can help locate a tumor as well as polyps, which can be removed before they become malignant.